Hello, welcome to my channel. I'm going to discuss to you about 5 different thermometers. We have oral thermometer, tympanic, the Auxilia, forehead where we use infrared non-contact thermometer, and rectal thermometer. So, yeah, we will discuss the advantages, disadvantages, and how to use it. Again, ulit-ulit. Okay, we'll start with forehead, the non-contact infrared thermometer. When because nowadays we always see that, they're like a gun that they point on your forehead when you go to airport or public areas because of the COVID. That's the forehead non-contact infrared thermometer. The advantage of it is it prevents cross-contamination because it doesn't contact with skin. So you don't have to touch anything to check the temperature. So you don't have to get contamination. Like if I have a germs, it will be transferred to the other people. There's a chance if it's contact, but this one, it's good. The advantage is it's contactless, and you don't have to be contaminated. Number 2, its advantage of it is quick and easy to be tolerated. You don't have to feel threatened because others, you put it on oral, some are on Auxilia, some on rectal, and it's a bit, you can't tolerate it. Another advantage of it is easy to use and to clean, and easy to retake temperature. If you're not sure about that temperature that you took, you can just do it again. Ching! And it will take maybe 2 seconds, 3 seconds. Unlike the others will take like 30 seconds. So the disadvantage of it is it's more expensive, but sometimes we don't have to buy it. We don't have to buy it. We just it's just the way it is. Like if you work in a company, they will provide those. But if you want it at home, it's okay, but you don't need to buy expensive thermometer like that. Anyway, the other one is, the disadvantage of it is that it can change the reading if a person is having a head covering, like a cap on their head, and if their position is different, then you might get different reading. Also, the environment can change the reading as well. Okay, the second one is the Auxilia, where they put the thermometer here. I don't have a sample, but I might just pop up a sample in my video. The advantage of it is it's safe and it's non-invasive. It's more appropriate for neonates or babies, because how can you put on oral on the baby's oral temperature thermometer? It's hard, but it's the easiest is Auxilia. It's useful for to have, it's useful if somebody has oral like inflammation or have difficulty breathing in the nose, and they breathe in their mouth. It's that's the advantage of it. It's useful if they have difficulty breathing. Yeah. The disadvantage of it is it's less accurate site, as there are no main blood vessel in Auxilia. It's the most less accurate. Reading may be affected by environmental temperature and sweating. So if they are sweating, then you might get different reading. So the third one is tympanic ear thermometer, where we check the temperature using they point the thermometer on the ear, like they have like that. I don't have it here at home, but I'll just pop up the thing in here. The advantage of it is it's accurate. It's accurate because the tympanic membrane shares the same blood supply as the hypothalamus, which regulates body temperature. So tympanic is the second most accurate thermometer. The first one is the arterial, but it's very invasive, where they'll have like they will insert some catheter in artery and they will check the temperature, but it's very invasive. So the second one most accurate is tympanic, because again the tympanic membrane shares the same blood supply as the hypothalamus, and the hypothalamus is the one that regulates body temperature. It's accessible and it's fast and non-invasive as well. You don't have to cut the skin, so it's not invasive. Changes are often seen in the tympanic membrane before other sites. The advantage is that changes are often seen in the tympanic membrane before other sites. So you will get accurate reading because it's in the tympanic site rather than Auxilia or oral. So they will get the best result before the Auxilia or the oral will get reading. They will have accurate reading first. Disadvantage of tympanic is if the patient has earwax or luga in tutuli in Tagalog, you might not get a good reading. The second disadvantage of it is it can't be used to patients with suspected ear infection, also with patients who undergone insertion of grommets. So if they are like babies or children that had insertion of grommets, it's a procedure in the ear. It's operation on the ear where they insert grommets to release some air so they won't have fluid on the ear. It's weird. So after that operation, we can't use tympanic thermometer. So yeah, rectal. That fourth one is rectal thermometer. It's considered fairly accurate, maybe third to tympanic. The disadvantage of rectal is it can't use it for people who has diarrhea because it can change the result. If they have rectal disease, hemorrhoids, and if they are undergoing rectal operations. It is very invasive as well and unpleasant for the patient. Imagine, you will ask them to remove their pants and turn, and then you'll insert the thingy on their bottom. It's not good. So it's not really advisable. And the fourth disadvantage of it is it's inconvenient and it's difficult to perform, which I already said. So yeah, the fifth thermometer is oral. Actually, oral, rectal, and axillary. we use the same thermometer. We just have like a probe and change the probe. But we don't normally use rectal. I haven't done rectal thermometer check in the past in hospital, so don't worry. If you go to hospital, you won't get rectal thermometer check. Temperature check. So the fifth is oral, and it's convenient and easy and accessible. That's the most used in hospital where I work. The disadvantage of it though is it can't be used for people who are confused, unresponsive, and unconscious, and has an endotracheal tube in situ, or people who cannot follow instructions, because we will ask them to open their mouth and put the probe under their tongue and keep still like that. And if they are confused or if they are unresponsive, you won't be able, or if they can't follow instruction, they won't be able to do that. So that's a no-no for people who are confused and aggressive. Don't do it to people who are aggressive, because maybe they'll hit you with that thermometer. The another disadvantage of oral thermometer is reading may be affected by food, fluids, smoking, chewing of gum, or respiratory rate of over 18 minutes per minute. 18 breaths per minute. So if they ate, if they had like coffee or tea or juice, orange, it will change the thermometer. Obviously, because when they drink hot coffee, of course, the temperature in their mouth is high. High. And if they drink like cold drink, of course, they will be low. So make sure that don't use oral temperature when they just had their tea or they just ate, or if they're having bubble gum. And if they are breathing 18 breaths per minute, because if you keep breathing on the temperature thermometer probe, it will change the reading, because you're like blowing on the temperature probe. So yeah, so that's the top 5 thermometers and their advantage and disadvantage. So yeah, see you later, and yeah, easy lang. Keep safe, and yeah, I don't know what to say anymore. So till next time, to all the people there that is wondering which one is better and which one is not better, and yeah, so yeah, bye.